Titi, it's the end of October.
It is.
It's been 31 days since the rollout of the Social Health Authority. This is the first month that people now start making payments into the Social Health Insurance Fund, SHIF.
Yes.
But it's been a shifty issue for many people.
It is.
Terminally ill patients who are struggling to get treatment as hospitals demand cash because of challenges with the new health system are pleading with the government to revert to NHIF. At KNH and the Kenyatta University Teaching Referral and Research Hospital, KUTRA, the country's two main referral facilities, patients are undergoing harrowing ordeals, unable to access urgent treatment under SHIF. They say, they've quoted Salome Kamau, who is a kidney patient at KUTRA. She says, under NHIF, dealing with chronic kidney disease, in my case, was much more manageable compared to the current predicament. NHIF used to deduct 8,500 from my cover for each dialysis session because I need 2 per week. Now I'm compelled to pay 11,000 shillings out of pocket every week just to stay alive. She has suddenly, this month, had to fork out 11,000 shillings a week. It's 4 weeks. 44,000 shillings. Now put in transport, put in all those things.
50.
Salome has spent 50,000 shillings this month just to stay alive, like she says. The truth is, SHIF has no tangible benefits, she complained, adding the hiccups occasioned by the 104 billion integrated healthcare system that's not working as expected is adding insult to injury. She needs urgent tests before a team of experts operate on her to remove gallstones, a delicate procedure, according to Dr. Onyimbo Karama, the Director of Clinical Services at KUTRA. She is also in dire need of dialysis. Dr. Karama says because she's a first-time patient here, we have to do pre-dialysis tests. She has to pay out of pocket, and tests include blood, urine, and imaging tests. He explained that the patient has to pay cash because what the Social Health Authority allocates in their renal packages is not enough to cater for these tests, as well as the consumables during dialysis. Before October 1st, when I was going for treatment using my NHIF card on 3 occasions, I was admitted at KNH and NHIF sorted everything. I remember my first bill was 55,000 shillings. The second bill was 80,000 shillings. The third bill was 40,000 shillings. NHIF footed the entire bill. I was diagnosed in January 2020. I started my dialysis in February the same year because both my kidneys have failed. I've been to various dialysis centers, from KNH to Kenusa Medical Limited, a social enterprise that builds and operates dialysis centers in partnership with Mission Hospitals, and in this case, Fatima Hospital in Rongai. Fatima Hospital and Kenusa parted ways last year, a move that affected many patients. Kenusa was fantastic. My health improved when I started my dialysis there because they used to be very keen on iron maintenance. She disclosed that the dialysis centers she has been to are not offering Apple injection and Venofar drugs for chronic kidney disease patients because SHIF does not cater for them.
You know, it is of interest, Eric. This one, if I look at the Star, they have a similar story, but it's the complete opposite of that. The headline is, patients in public hospitals praise Shah, enjoy benefits.
Allah?
I also went Allah.
Allah?
Yes. Registered patients are getting fast and free treatment from public hospitals. Okay? Expectant mothers are also enjoying free prenatal and postnatal services through Linda Mama. At Nakuru Provincial General Hospital, Medical Superintendent Dr. James Waweru said the hospital has helped many patients to register. Many patients with chronic diseases have benefited from the scheme following the low cost compared to NHIF. The few challenges are faced because of systems delay, because some don't have IDs, but once they get IDs, they access the treatment immediately. They said most registered patients at the facility have undergone emergency surgeries, dialysis, chemotherapy. Expectant mothers given birth for free under Linda Mama. There's a gentleman called Macharia Kimani, an elderly patient who underwent emergency surgery, was admitted to the hospital 3 days ago. For 3 days, I'm quoting what it is said. He said, I have been to hospital and have not paid a single shilling. All my bills have been taken care of by Shah, says Kimani.
Okay.
Yes.
So it's working in some areas, and in some areas where it really needs to work as well.
So
it's not. Because this picture here, they have a photo of Salome Kamau. I mean, both her kidneys have failed.
That
It's
is not
been
a good
4
thing.
years. She was diagnosed in January 2020. It's been 4 years.
Yes.
She's been going through dialysis. She needs dialysis every week and not just a session. Now at Kutra, they're like, all right, we need to do some tests because we need to know now how do we treat this patient. SHIF is not paying for these tests. So we need her to pay out of pocket.
In fact, the Star has a whole page full of the story. A patient in this place, a patient in that place.
So the different patients in different hospitals.
Yes, and they're saying this one even registered. It says they registered immediately. And got
chap,
and you get treatment chap like that. Too. So this is where now the Ministry of Health needs to come and tell us what it is that is actually happening, because these two stories are so contrasting.
Yeah, and it's a matter of health.
It is a matter of health. It is a matter of health.
Yeah.